Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, some of the highlights. Today, controversy over the infectious diseases bill as lawyers and governors forum urge House of Representatives to step down the bill. A Majority on the streets of Bauchi despite claims that they have been repatriated. And WHO warns against the likelihood of the coronavirus staying with us for some time. The Infectious Diseases Control Bill 2020 was introduced on the floor of the House of Representatives as a public health emergency framework, first by the Speaker of the House of Representatives, Femi Gbajabiamila. According to him, the weaknesses of the present system has already manifested in the inability of governments to hold to proper account those whose refusal to adhere with Nigeria's Center for Disease Control NCDC guidelines led to the further spread of coronavirus in the country. But ever since its introduction, lawyers, some lawmakers and governors have canvassed divergent views on the bill. Now, the Nigeria Governors Forum is saying that the bill has to be stepped down. And our theme will look at how this impacts the management of the spread of COVID-19. We have a legal practitioner and other experts on the issue. According to the Nigeria Center for Disease Control NCDC, 164 deaths have been recorded and 1,070 patients discharged from various isolation centers across the country. The center also confirmed 184 cases of COVID-19 in the country last night, bringing the total number of cases to 4,971. The new cases were confirmed in 21 states and the Federal Capital Territory, with Lagos State recording the highest cases at 51, followed by Jigawa with 23 cases. Bauchi and Katsina have 16 cases each, Kano 14, FCT and Rivers. Looking at the regional figures showing Lagos in the southwest with the highest figure at 2,041 cases, followed by Kano in the northwest with 707 cases. The FCT in the North Central region comes next with 370 cases. Bauchi still leads in the northeast with 206 cases. Edo State tops in the south-south with 89 cases, and Enugu in the southeast leads with 12 confirmed cases. The last is yet to be heard about the controversial Infectious Diseases Bill 2020 introduced by the House of Representatives Speaker. Now, the bill seeks to strengthen the NCDC and make it more proactive and not just reactive and function when there is an outbreak. But rising from their meeting yesterday, the Nigeria Governors Forum slammed the process, saying there is need for more consultation. That was decided at the 8th teleconference meeting, which held on Wednesday. Joining us on the program via Skype is a legal practitioner, Mr. Daniel Bwala. Welcome to the program. Mr. Bwala, is the bill, the Infectious Diseases Bill, is it defective? And do you support the view of the Nigeria Governors Forum that it should be quashed?
No, we need to have a perspective as to whether or not the bill is important. I believe that the reason they are asking for the bill to be quashed is because they probably haven't had a careful look at the bill. We all have to agree, first of all, that the Quarantine Act is obsolete and outdated because of certain provisions in that act that is so far inapplicable. If you look at the punishment, the amount that somebody convicted will pay, if you look at enforcement, you look at the aspects of human rights, and you look at the definition of diseases and infection, which does not cover COVID-19 and other viruses are in the family of coronaviruses. So because of that, there is definitely need for us to repeal and replace that act. However, the reason why there is wide agitation against the success of this bill is because the content of the bill substantially is controversial. And I agree that the bill must stand. We must make a law. But I also agree strongly we need to remodel the bill to be consistent with our demographics, with our socio-cultural background, and with the facts of what we are facing today, because the bill was largely copied from the Singapore Bill of 1977, which is 43 years. And even in Singapore, at the moment as we're talking, they are talking about how to repeal and replace the bill that we are trying to copy here. So we need to work on that bill. So to that extent, I agree the bill has to stand, but we need to then work on the bill and make sure that it is consistent with the time. If you permit me, I will tell you some of the contents in the bill that are deemed as controversial. There is this aspect of compulsory vaccination. Even when you look at the World Health Organization standard procedure for member states to copy in making their laws to be consistent, there is no provision for compulsory vaccination. If you look at chickenpox, smallpox, all of the infections we've had in the past, the vaccination were not compulsory. So putting it in the bill that it is compulsory is now selling the narrative that there is an agenda to it. There is the aspect of human rights in the bill that we need to tinker with. Because first of all, our law enforcement agents have never had a challenge enforcing the law. So we cannot create a bill and add more powers to them. If you look at what is happening in Nigeria with enforcement, people are maimed, people are killed, so much is happening. So we need to tinker that. There is also the role of the judiciary in the bill that is required. Now, when they say a health officer or police officer can arrest somebody without warrant, if he reasonably forms the opinion that that person is about or is in a place that is restricted. Now, to me, that is ambiguous. To me, that one is not lawful, because whether the bill is legal, lawful, or enforceable is to be tested by the law court. And since in the FCT, we have mobile courts that are moving up and down, there is nothing wrong in us putting in the bill that with the warrant from a mobile court, somebody can be arrested. Because if you give a direct translation to say, because those who argue in favor of that stringent or draconian aspect of the law are saying that even the Administration of Criminal Justice Act gives the law enforcement the right to arrest without warrant anybody that he forms the opinion is about to commit a crime. So do you then translate it to now say that the health officer or the police officer is going to arrest somebody that he reasonably forms the opinion is about to contract a disease? No. That is the aspect of the bill that is also draconian when they say the Director General can decide to cancel any public meeting if he forms the opinion that the gathering will spread the disease. We need to be very accurate and specific. Otherwise, you'll find that in a state, if the government or its agent are going to go against certain gatherings, all they need to say is that they form a reasonable belief that the disease of coronavirus or any other disease in the future is about to be spread there.
All right, Mr. Bwala, we appreciate your time. So you're saying the uproar is unnecessary, and indeed they should go back to the drawing table, redraft the bill to suit some of these things you've mentioned.
Thank you very much.
Your time on the program, legal practitioner Mr. Daniel Bwala there. But let's take you now to the latest COVID-19 situation reports released by the NCDC. It shows that from the number of samples taken so far, we're having over 29,000 when you look at the situation report from the NCDC. Also, the number of confirmed cases in the country at over 4,000. The most affected age group are between 31 to 40 years. And from the demographics, 69% are male, 31% are female. There's so many more details or information from the epidemiological report from the NCDC. And to dissect this in the studio is a lecturer of epidemiology and biostatistics, College of Medicine, the University of Lagos, Dr. Oluwatosin Akinshola. Thank you so much for joining us on the program.
Thank you. It's my pleasure.
Let's start with the report from the NCDC, and that is the last one. From what we can see, there's still a long way to go in terms of testing. When you look at the figure, 29,408 compared to the number of people in the country.
Yes, definitely. There's still a long way to go. That means we need to really double our effort concerning testing. Because look at the statistics, 29,400 out of an estimated of about 200 million people. It's just less than 0.01%. So we still need to have a lot of work to do.
Now, the government has talked about 2 million tests conducted in 3 months. So that's what they're hoping to get, and having the states having capacity to test at least 50,000 people in that period. When you look at the states and the capacity, and also when you look at the numbers, because right after Kano, we have the FCT, we have Katsina, we have Bauchi, Borno, we're having more and more cases. Do you think these states have capacity, especially to contact, trace, and then building more capacity to test?
Well, actually, in terms of contact tracing, I'll say it's an Herculean task in the country, looking at the nature of our health system. And apart from it, the economy aspect of it, people have actually down financially, otherwise. And recently, about a couple of weeks ago, when the lockdown was implemented, you can see some of the reactions from some part of the country. So, by and large, I think in terms of the contact tracing, we still have a long way to go. Still have a really long way to go. But you can say the government are trying their best in that respect. And we also have daily briefing every day, and for us to have the latest report on it. But that 3-month projection
right.
is, well, it's still some question mark about it. But by 3 months, let's see what we can achieve by then. They will know whether we can actually make it or not. If
you look at the provenance from the NCDC, it says that about 3,104, 65% have no epidemiologic link. What exactly does that mean?
Yes, when we are talking about no epidemiologic link, that means among those people that are actually been confirmed
to have COVID-19,
they cannot actually identify their source of their contact. That means that if someone is now being confirmed of cases, now maybe when they are being asked, okay, is it through family or relative or through workplace or through contact?
Travel.
There is no link, but you just know that when they are being tested, they are positive. So that's the meaning of no epidemiologic link.
So is that a big worry for us if we can place where these cases are coming from? And isn't that what is fueling our community transmission?
Yes, it's a big worry, because if actually someone is being confirmed as a case and there is no epidemiology link, that means I need a source of worry. It may be that the person wants to conceal the identity. It's a possibility. Or maybe the person actually, they don't even know who actually, at the time, he got the contact from. So actually, it's supposed to be a worry for the government, and more especially the NDC, those who are being the vanguard of nipping this pandemic in the bud.
We still have 2 states that don't have confirmed cases, Kogi and Cross River. What are your thoughts about what might be happening?
I think, well, for Kogi and Cross River State, we're actually looking at the information that from Kogi State, from the population of Kogi is about 3.3 million. And they said they have about 111, number of testing they have is 111. So comparing 111 to 3.3 million is still very infinitesimal fraction of the population. So before they can actually be saying that, okay, they actually don't have any case, how many people have they tested? How many random testing have they conducted? So it is when they look at the statistics of the number of random testing they have conducted. You get what I'm saying? So that's when they can actually be able to hold their head up that, okay, we don't have any number of cases. But looking at the 3.3 million of the estimated population to number of people they have tested, it's really an infinitesimal to be said.
Explain to us the demographics. Why we're saying more male, and then we're having 31% female, and the age range is between 31 to 40.
Yes, looking at the demographics that I mentioned, for the male, we have about 3,303, which is about 69%, and the females. That shows that this condition of COVID-19 is more preponderant in males than females. That means the males are more likely at risk of contracting disease, and maybe because due to our nature, our physiology nature, and it may also due to the nature of our engagement too. So, but here shows that, from this information shows that males are more predisposed to contracting diseases than females. Then in terms of the age group, the information is that 31 to 40 constitute 25% of the population. And if you look at it, majorly 31 to 40, these are the age group that are actually, we can regard them as the most active population of the population. The age group, they are actually active. So they believe that they can move around, they can engage in many activities.
That's probably what makes them susceptible.
So I think that may be reason can be addressed to that.
All right. We appreciate your time, Dr. Oluwatosin Akishonla, lecturer epidemiology and biostatistics, College of Medicine, University of Lagos. Thank you for joining us.
It's my pleasure.
So to come on our COVID-19 update, more on the efforts across states on flattening the curve. Join us again. The Adamawa State government has commenced the repatriation of over 400 Almajiri from different parts of the state to neighboring Gombe and other northern states. The secretary to the Adamawa State government, who doubles as the chairman COVID-19 Containment Committee, says the move is in line with the agreement reached at several meetings of the Northern Governors Forum prior to the escalation of the coronavirus pandemic. The secretary, while supervising the repatriation at the capital school, Yola, states that the exercise, which commenced with 132 Almajiri children, will continue till they are all repatriated. Our correspondent Hajara Aliyu joins us now for more on the situation in Bauchi State. Hajara.
The Almajiri evacuation from Bauchi State appears not to be settled, despite claims by the state government that these children have been evacuated to their respective states.
We have noticed that we have only sorted out about 819. We have received 904, and we have reunited these people. I hope you are doing some counseling and guidance to the parents when you are uniting them. That's why the involvement of the local government chairman is very important.
Some of the Almajiri in Bauchi State are still seen roaming the streets. Earlier this week, the attention of the Bauchi State governor was drawn to the fact that some of these Almajiri still beg in the nooks of the state. The governor was surprised by this, despite issuing directives that they should all be evacuated. But he promised to do the needful. But just yesterday, we went to one of the markets. Bauchi is on a partial lockdown, and at least 3 times a week, people are allowed to go to the markets to restock. Yesterday was one of the days, and we saw some of these Almajiri in that market. Most of the people we saw in the markets, especially the traders, were not wearing the face masks. Some of them were not adhering to the social distancing guidelines. And this Almajiri could be seen moving from one person to another begging. And we know that these children are susceptible to the virus because of how they move from one location to another unchecked. At least recently, some of the Almajiris that tested positive for the virus were under the care of the state government. But for this set of Almajiri that still move from one place to another, if they come down with the virus, it may be too late before it is discovered. Why this Almajiri still roam the streets despite claims by the state government that they have been evacuated are questions that the state government should be ready to answer. From Bauchi State, Hajara Aliyu, Channels Television.
Well, let's dissect some of the issues arising from the coronavirus pandemic. And joining us here in Lagos is Dr. Ganiyu Jamiu, a public health physician. Thank you for joining us.
Thank you.
We also have Dr. Ibrahim Nguide, Director of Medical Laboratory Services, Borno State Hospital Management Board. Thank you for joining us on the program. Let's begin with you, Dr. Jamiu, and that is, you know, hearing about how the Almajiri situation, the movement, the deportation, the back and forth, and some are even smuggled to their states or out of their states of origin. How do you feel, especially as we're battling to stop the spread, community transfer of COVID-19?
Actually, the issue of Almajiri is really a real concern. Why is it happening at this point when we are talking about trying to reduce community transmission? I don't know. Government need to look at this because it's really a real concern. Because their movement is like just transmitting, sharing the infection from one state to the other. Because as you can see in some states, some of these Almajiri are already infected with COVID. By trying to take them, to transport them to, mix with their parents, they end up spreading some of this infection. I think the federal government need to come in. The Presidential Task Force on COVID need to intervene on this. If not, they're all Nigerians. Why can't each respective state, devote a place, maybe a school or an institution whereby they can be taken care of pending when the epidemic subsides for a while. But the way we are being, the movement is a major concern because some of these people will end up going to, mix with their parents, and through that process, some may have been infected, and in so doing that by transmitting those infections to their relative and so on. So I think that should be a check. I'm advising the government that if it's possible, there is need to stop this movement of almajiri. Let whatever state government can do, let them handle the almajiris. They can just confine them to a place, provide the basic necessity, food, water in a school, and pending when the epidemic subsided. I think that would be the way forward. Thank you.
Do you think that our government, with the many measures that are being put in place, they understand the gravity of their actions? And this is when we hear that we're having more and more cases, people are not adhering to the protocol, the guidelines from the NCDC, from the PTF, and we're still having a spread.
Yes, you see, whether we like it or not, lockdown or lockdown, we are still going to get cases. The reason is because there is established community transmission of the virus. So I will advise that if it is possible, we need to, the lockdown was eased out on 4th of May. And I want to believe that there have been some gains, despite the rising number of cases. It is said that there are some people who depend on daily earning. They cannot feed for themselves. People can, go to a major work, issue of workers being, being sacked and so on. At least that pressure has reduced a bit. What we just need to do, like, if we can borrow the idea of this Sweden model, is a new model. Since the pandemic started, Sweden has never locked down. What they did, and even recently they were commended by WHO, and they're even recommending Sweden model to every other country that is battling with this pandemic. What we need to do, there are two things. The government there should be mutual cooperation between the government and its people. What do we mean by that? That's trust and accountability. There should be clear understanding between the government and that this is a major problem and it involves every other person. Then secondly, the people must own these preventive measures. And what do I mean? It should be a collective responsibility, individual responsibility. People should look at it as, okay, this preventive measure, I'm protecting myself, I'm also protecting others. And one thing we can go by this is that, as far as we are concerned, every person is a suspected COVID case until proven otherwise, because we now have a lot of asymptomatic cases. So I think if we can go by this, and I will also plead, behavioral change is something that takes a long time. So if we can engage all the stakeholders, like all these transports, workers association, it's not a one-off talk. It should be a continuous engagement. We need to reinforce these messages. We need to sustain it by engaging them, letting them, even at the park, they can, use signages. They can even use some demarcations to, implement social distancing. Right. So they can serve as a role model. Even the banks, bank can also implement
hope that we can get to see that.
It's continue. And I want to even plead, if the government can even use that as, introduce a kind of reward system. Whenever in a park they are doing that, they can just, give like hand sanitizer or something, so that people can view it on TV and say that, okay, wow, people are really doing this, or this is what the government wants.
I wish we had more time to talk about this issue. We appreciate your time, Dr. Ganiyu Jamiu, public health physician. Thank you for joining us. Unfortunately, we could not reconnect with Dr. Ibrahim Ngude. Hopefully, we will again from Borno State. But the World Health Organization is warning that the virus may never go away from the world, and citizens will have to learn to live with it. Speaking at a briefing, WHO Emergencies Director says even if a vaccine is found, controlling the virus will require a massive effort. The message from the Nigeria Center for Disease Control is take responsibility in protecting your health. The NCDC says the virus that causes COVID-19 can spread by touching contaminated surface and then touching your face. So while in public, avoid touching door handles, stereos as much as possible. The website has live updates on all you need to know. That's our COVID-19 update on Channels Television. Thank you for watching. Another update comes your way again at 6 p.m. I'm Millicent Walker.